Management is efficiency in climbing the ladder of success. Leadership determines whether the ladder is leaning against the right wall. The coronavirus has created great uncertainty, elevated stress and anxiety, and prompted tunnel vision in which people focus only on the present rather than towards the future. The current situation poses an enormous challenge for leaders across the world. The uncertainty embedded in this situation makes the leadership challenge even more complex. At such times, a leader's words and actions can help keep people safe, help them adjust and cope emotionally, and finally help them put their experience into context. On this note, let me introduce you to our next speaker, Dr. Vijay Natarajan, sir, the Chief Executive Officer, Symbiosis University Hospital and Research Center, Pune, who will be unfolding this crisis and putting forward the infinitely complicated challenges faced during the pandemic. With around 3 decades of an astonishing career in cardiothoracic surgery, Dr. Vijay Natarajan is trained at Melbourne, Australia and Boston, USA. Sir's qualifications include an MD in USA, MS, DNB, MCH, and CVT, as Australian Fellow, and an MBA in Healthcare Management. Sir is an Australian and American board certified adult and pediatric cardiac surgeon. Sir currently holds the position of Chief Executive Officer at the state-of-the-art Symbiosis Hospital and Research Center, Pune, that has nearly 900 beds and having treated over 4,500 COVID patients ever since the pandemic began. Sir has pioneered a cardiothoracic program at Pune Hospital for more than a decade. He has played an instrumental role in the setting up and upliftment of Symbiosis University Hospital and Research Center right from its inception, and has been at the helm of steering the administrative and leadership matters in the COVID-19 crisis. I take great elation in welcoming you, sir. I believe we have Dr. Rajiv Yerodekar, sir, with us. He would like to say a few words.
Am I visible? I don't know because there's some technical glitch, but as long as I'm audible, it's fine. So just have the pleasure of corroborating the good words Nabila said about Dr. Natarajan. And beyond being an excellent cardiothoracic surgeon, what we find specific use and specific applicability of Dr. Natarajan to the healthcare scenario is his sympathy, empathy towards patients, and his ability to provide, his vision to provide affordable, ethical, transparent healthcare to the masses. And his sense of humor, his sense of compassion, and at times, and I'm sure his talk would be laced with some amount of sarcasm at which he is very adept. Dr. Natarajan is a delight to hear on any forum, and I have been privy to and I have been witness to his excellent oratory for over 3 decades from now. So all the best, and it's a delight to have Natarajan here, Dr. Vijay Natarajan, to be speaking. Tamilian by birth, he professes no connections with the original state, being more a Punekar in practice and in profession. All yours, Vijay.
Very much, Dr. Rajiv. Very kind words. Hope to live up to it. Thank you, Dr. Nabila, as well, for that extensive introduction, which you could have, probably summarized and made me feel less embarrassed. Thank you very much, both of you. So good afternoon, everyone. At the outset, I'd like to thank SYMHEALTH 21 and Dr. Saraf and his great team for inviting me and, giving me the privilege of being able to address you all today. I'd like to start with a disclaimer by saying that I don't claim any copyright over being a leader, or for that matter, a leader in the COVID-19 situation. All I'd like to do is just share our experience and whatever we've learned in the process and look towards the future optimistically. Broadly, when we speak of leadership, these are the words that I'm reminded of. Leadership being the art of getting someone else to do something you want done because he or she wants to do it. And that, I think, very aptly summarizes what a leader should be doing. Now, this is on the 8th of April, 11 p.m. at night last year. This is the photograph that we took before the first COVID patient actually arrived on our hospital campus. We had been designated a COVID center, which we did quite voluntarily. thanks to the magnanimity of our Honorable Chancellor, Sir, Dr. S.B. Muzumdar, who said that we should offer our 500-bedded facility, 500 at that time, to the COVID services before anyone even asked for it. So, as you can see here, this is before the first bunch of 20 patients arrived, and everyone was very apprehensive, anxious. Of course, they look like normal human beings once they arrive. But as you can see there, the nursing staff, they were sweating inside those PPE kits, which they were probably wearing for the first time in their lives. And part of the sweating was because of fear as well. But soon they rose up to the challenge, and they were able to deliver excellent healthcare. I always believe the core of any hospital is always the nursing staff. So this is a quick summary of our experience in last year. I have not put this year's figures here as yet. And as you all know, the rapidly rising second wave is a lot worse than what it was last year. So we did close to about 4,000 patients that we had admitted with us. About 1/4 of them landed up in the ICU. And of those, about 50% were on the ventilator. Our mortality rate, as you can see, fortunately was low and compares very well with the national average, which was about 3 to 4%. We were in the vicinity of 1.8 to 2%. In this context, we also had separate wards set up for our other team members who are frontline as well, equally frontline like the healthcare workers, which were the police personnel. This is just to give you a glimpse of what the ICU looks like, in a COVID context, where you can see everyone wearing the, protective gear and delivering services selflessly. This is, typically what is a new factor in COVID-19, where there is something called as proning, which is something you have probably heard of, where the patients are actually made to lie on their stomach rather than on the back. So you can imagine it takes, as you can see in this photograph, at least 6 members to flip that patient onto his stomach or her stomach. And some of them are not really light either. So that's just to show you the degree of effort that goes into providing care for COVID-19 patients. So broadly speaking, now this clearly, the COVID-19 pandemic is a disaster in every sense. So what exactly as leaders should you be doing when you are faced with any such or similar disaster in the future? I thought the first thing is that you pause for a moment and try to understand the magnitude of this entire disaster. Try and understand the various aspects of it. And then once you've figured that out to a reasonable extent, it's never going to be 100% possible, then you prioritize and decide what you want to do first and subsequently. It's very important to develop a core team. It's not a one-man job, even though some people may think they can. It's always about a team effort, just like Dr. Lal Joseph just mentioned a little while ago in the context of quality. And it's good to involve all the stakeholders. When you're talking of stakeholders, I mean the in charges in the field of any hospital areas like operations, administration, finance, marketing, biomedical, maintenance, nursing, most importantly. All of these people need to be involved in this effort. And it is important to also realize that there is nothing to feel as if you are lesser if you had to take the help of your seniors. And in this context, I would like to specifically mention the tremendous support that I've received from Dr. Rajiv as Dean of the Faculty of Health Sciences at Symbiosis, Dr. Vidya, who is the Pro-Chancellor of the university, and of course, above all, our Honorable Chancellor, Sir, Dr. S.B. Muzumdar. So we must realize that none of us are any Superman or Shaktiman or Spider-Man, because if you don't do this, you'll soon be a dead man. So that is one of the things I wanted to highlight here. The next point is understand that this is not British rule. There shouldn't be this kind of hierarchy that goes into a system, especially in a disaster. It's important to encourage leadership at all levels. You can get leadership even at the level of the front desk staff or housekeeping or in the nursing staff. So it doesn't necessarily have to be a top-down approach. That's something one must realize very importantly in a disaster situation. Should also be able to envisage multiple scenarios. The scenario may not be as straightforward as you would wish it to be. There could be many side stories or many other complicated dimensions to the primary disaster. And always remember that if you wait for that perfect moment and the perfect setting to start doing things, that will never happen, because speed of decision making is of extreme importance. So things may not be as great as you want it to be, but it's important to just get going. And also to remember that you have to stand upright, do what is right for that occasion. You're not here in a disaster to be popular. My apologies to politicians, but they may be not in agreement with this statement. But the important thing to remember is that do what's right. It's important to develop a good network both within and outside the organization. We'll see why a little later on. But it is that networking that helps you in this crisis, where you want to get your jobs done from your team members, whether you want outside help, whether it's from politicians, bureaucrats, police personnel, medical supply people. It's important to have that great network. Always have your ear to the ground. You need to know the ground reality. You can't be sitting in an air-conditioned room and dictating orders from there. You have to be at the ground level, right at the front of this war, if I may call it so that you can actually deliver the best of services to these desperately ill patients. From the recent past, we've seen these instances of fires and oxygen leakages and wastages and the unfortunate loss of life in that context. So it's very important to learn from others' mistakes and set processes right. We can't afford to make all the mistakes ourselves, otherwise we would never survive this pandemic. Keeping the staff motivated, I just thought I'd make a separate slide on that. It's very important to take care of one's own team, because if your team is well taken care of, then they will be able to deliver the best of services. Everyone has fears, everyone has anxieties. It's not only the people who come from outside. Our own team members are humans as well. In a COVID situation, everyone is afraid of getting COVID. So it is important to allay their fears. Regular counseling sessions, therefore, must be held in that context, something which we do at regular intervals in our hospital, so that everyone feels motivated, informed, and taken care of. It's important always also to focus on positive statistics. If you keep watching some of these news channels, you feel depressed at the end of the day. It's very important to talk about the survivors, the ones who've gone home well, the ones who've come off the ventilator, very sick patients. It's important to focus on that rather than just the morbidity and mortality that is happening all around. It's important to emphasize that your team is well protected. This is something that was a top priority for us well before the pandemic even hit us. We were well stocked with, the PPEs and N95s and sanitizer and everything. So throughout the entire year, though there were some hospitals where we heard stories of people being made to, go into the ICU or different work areas underprotected, I take great pride in saying that not a single member of my team was forced to go into any work area underprotected. We also ensured that, our team members had special diets, vitamin supplements to, boost their immunity. We never overworked our staff members. We would ensure that it was the reasonable hours of work that they were doing in the pre-COVID situation as well. There may have been an occasional extension of duty, but it was the exception rather than the rule. We must have a contingency plan for the future. So whatever may happen today, something worse could be happening tomorrow. So we should be looking at that from the point of view of our preparedness and keeping our staff accordingly informed and motivated. We've already spoken about the immunity boosters. It's important that everyone gets good sleep as well in the midst of all that is happening. And most importantly, I think, again, the point that I alluded to in the last slide, as a leader, it is important to be right there in the middle of the action rather than far away in some remote corner. This is a slide from the day of Nurses Day last year, when in the midst of this pandemic, we got a chance to actually commemorate and thank our nurses with those pink badges that you see on their chest and celebrate that day in a limited manner in whatever way permissible in the midst of that pandemic. So now talking of what would one need? I mean, this is just, again, as I said, from personal experience. I claim no authority in being someone who knows everything about leadership. This is just a few of the points that I thought I would put across, which I thought would help in the context of leadership. The ability to preempt or predict the future. I mean, as much as it may be looked at as crystal ball grazing, but it is important to know what tomorrow can be. That way you can prepare for that today itself. And in a crisis, as you can see from the various things that are happening in terms of shortages, it is extremely important to stock up. That's just one example. Focus, as I said, again, on potential problems. It's not something, so for this, it's important to have a team. You can't do all the brain work yourself. It's important to have a team that helps you looking at potential problems. Solutions providers, you may have many, but you also need to have people who can tell you these are the likely problems that are going to happen in the future so that you can preempt it and deal with it in a proper manner. And that is what includes as a holistic approach to look at the entire disaster, in a comprehensive manner rather than in a siloed or narrow-minded kind of approach. Team development, I've already spoken about. It's always teamwork that leads to success, never an individual. Calm nature, well, more easily said than done, but at the very least, I would suggest if one cannot be intrinsically calm, and let's try and be extrinsically calm so that your team doesn't see any panic on your face. If you as a leader cannot communicate that, then it will be difficult to expect the team to deliver. So that's important. You got to be an excellent communicator. We got to learn from our Prime Minister there. The ability to convey what you want to say and on a regular basis. It's not a one-off communication. It's important to keep everyone up to date with whatever is happening. Everyone is on edge, and it is important to allay fears, soothe nerves. There will be conflicts. Tempers will be running short. So it is important to communicate and be in touch with the team 24/7. This is a no-brainer. One has to be optimistic in this scenario, but at the same time, one should not be optimistic for the sake of being optimistic. Be a realist as well. Give the actual figures as they are. Mention whatever are our problems that should be shared with the team on a regular basis by being truthful to them. And this is what I say, which will be an instant hit for one to be a leader, where, it's an acronym. It's important to be honest. It's important to have an integrity and absolute transparency in your dealing with everything. So putting all this together clearly goes without saying that one has to be a multitasker here, and clearly the fairer sex, I think, is at an advantage any day. All the males in the audience, I'm sure, would accept that without any challenges. It's important to have a good deputy because you can't be going on 24/7 fully charged. So there will be times when you may need a little break. You may even fall ill, unfortunately. So it's important to have a good person who would take over your responsibilities and deliver at an equal level. And you often are told to have a plan B. I go all the way to plan Z. It is important to have multiple possible scenarios and whatever one is going to do in that situation, how to deal with it. And this is most important. This is where I think we failed as a nation, and that's why we are facing the second wave. Respect the enemy, however small. It may be a tiny virus, but remember, this is one of the smartest viruses around and has come to bite us in such a big way in the second wave. We took things very lightly in November, December, thinking that COVID-19 had gone forever. And one could even call this COVID-21. But these two variants of the new virus, quite dangerous, as you can see, with the rapidly increasing numbers and possibly a more virulent virus as well. So that's something we must never forget. The importance of communication, I thought, should be a separate slide because it's extremely important, especially in a crisis where one should communicate, where we use the KISS principle, where you just said, KISS being an acronym for saying, keep it simple, stupid. So how does it help? Clearly, stress and anxiety of the entire team is reduced if you communicate properly, regularly. Keep it clear. Your communication should be simple, nothing complicated. Don't use technical jargon and stuff like that. And it should be frequent, most importantly. It's not a one-off affair. It's important to be honest and transparent because everybody knows the reality around. And if one is honest and transparent, that's how the team will have faith in you and you will have faith in the team. Always remember to celebrate the positives as we did in whatever limited way, in whatever the conditions may allow you to. But that is important as a kind of a boost to your team. There is something called as pandemic fatigue that has already set in. And in any disaster, that is bound to happen. It's difficult to expect people to be fully charged going on for days together. And therefore, these little incentives, so to say, or little gestures will certainly help. And all this needs to be repeated on a regular basis to keep going. So we have our session of daily briefings where everyone is kind of up to date with whatever is happening. Sometimes, this crisis situation may not allow you to do it every day, but it's important to give that update to your team so that everyone is on the same page. It's important to also have live updates of what is happening within the hospital. For example, one must know how many beds are available, how many oxygen beds are available, how many ICU beds are available, because it's a constantly changing dynamic situation. And the currently most in demand ICU beds and ventilators. So it is extremely important to have these live updates for you if you are in a leadership position. Feedback, that is crucial, disaster or otherwise. That's how one improves. And there's this Japanese terminology called Kaizen, which speaks of continuous improvement. And it can't be more important than in a crisis situation. And as you know, there is tremendous chaos that goes on whenever there is a disaster. Everyone is running in different directions, have different suggestions, have different ideas, trying to help, of course, but all that has to be channelized in a proper manner so that it all happens in a very streamlined fashion, again, with the best interests of patient care. It's important to understand, therefore, why is communication so important, especially in the context of patients. You need to allay their fears. You need to tell them that they're doing fine. They needn't fear for their life or that they're going to die, because that's the biggest fear in COVID. The relatives need to be communicated as well to tell them that their near and dear ones are doing fine, or tell them the truth as it is. If somebody is not doing well, so should be the communication. But it's important to communicate, and to your colleagues, of course, most importantly, so that it helps tremendously in mitigation of panic. So quickly, what are the lessons that we learned, or I learned personally in this entire last year of COVID, that one has to be ready to work outside one's comfort zone. One may have trained in a particular manner, may have dealt with certain situations, but it is important that we get out of that comfort zone and take up the challenge to the best of our abilities. It's important you get multiple inputs. There is complex information. You will get contradictory views, whether it is about treatment of patients, whether it is investigations to be done, or the protocols to be followed. So in many areas, you will get all kinds of information, and emotions run very high in this situation. Whether it's the patients, the relatives, the people who have sent you patients here, the referral doctors, bureaucrats, politicians, all kinds of people, self-vigilante groups and all kinds of things. So you have to deal and be able to deal with all of that, hopefully in a calm manner. It is important to connect the awareness of the entire situation, all around you, whether it is within the hospital, outside the hospital, in the city, in the country, and, connect that with your own awareness of the disaster, currently the COVID-19 crisis. And this, as I said, make it a deliberate choice to practice a calm state of mind. I know it is more easily said than done, but that's something that will really help one. I'm sure you agree that in a panic state, decision-making may not be easy and could often be wrong. Always look at the crisis as an opportunity. That's what our Honorable Chancellor, sir, has taught us. And in that situation, this could be a talk in itself. But certainly there are many things that we can learn from a crisis, how we can enhance services in a hospital, how we can increase the the quality, the patient load in a hospital, how different technologies can be adopted to improve the overall healthcare services within a hospital setting. Remember, stress can be good as long as it ensures a positive energy level. It's not always to be looked at as negative. Call it stress, call it pressure, but that is something even the batting legend Sachin Tendulkar has mentioned himself, that he always feels a little pressure and stress whenever he went into bat, and that's what kept him going. So that complacency is an enemy in a crisis situation. It's important there to be compassionate and strong. It's not either or, remember. In a crisis, you're dealing with so many people, so many situations, that it is important to not forget that one has to be compassionate, but in a firm manner. And also, like the airlines, where they tell you to first help yourself before you give oxygen to the child or whoever you're trying to help, always remember to protect yourself. If you're protected, then you can deliver. So let's not get into this sacrifice syndrome of, I need to deliver patient care. Yes, we all need to, but not without protecting ourselves. And we've had a few instances there where people have gotten infected because of not protecting themselves well. Of course, they fortunately went on to do well, but we should look at this self-sacrificing behavior should not be encouraged, especially in a crisis and especially in a leadership position, because you need to be around for the entire team to function well around you. It's important to have some family time if you can get it in the midst of all this, because remember, there has to be a professional and personal life balance and a sense of humor that should be maintained throughout this. Remember, none of us are getting out of here alive. I don't mean COVID, I mean generally about life. So if that is the case, then why not, smile through that rather than taking life too seriously? Because as I keep saying to many people, don't take yourself too seriously because nobody else does. On the 8th of April, the first bunch arrived, and this is that first bunch. On the 22nd of April, they all left happy, as you can see. So I'll quickly go through the last part of my presentation, which is about the responsibilities. As a leader, it is important to have clinical knowledge of whatever is going on in COVID-19. You can't be disconnected from that. You must be up to date with all the recent most protocols. You should be able to, therefore, intelligently interact with the patients, the relatives, nurses, doctors. If you are well informed, you can, disseminate correct information. Therefore, this is a constantly changing situation. So international guidelines are extremely important. For that, you must attend CMEs, which is a continuing medical education platform, which gives you an update on whatever is happening or the recent most changes in protocol. For example, last year when we spoke of chloroquines as a life-saving drug, today we don't even talk about it, just to give an example. Then looking at the administrative responsibilities in a leadership position, you have to be aware of all the government circulars, updates, so that you know what should be done and what should not. Looking at medical supplies and ensuring that that is regularly available so that there is no interruption in patient care. These are some of the examples, the recent most examples where there have been challenges. You have to be ready for audits, which may be conducted either internally or by external agencies. There are social responsibilities that come in the leadership position where you need to speak to patients, relatives regarding information. You may be seeking help from different NGOs and other companies which provide through their CSR funding or voluntary organizations who are ready to help. So one needs to be in contact with them, talk to them on a regular basis, and maintain a liaison between various people we have already spoken to who are important in this entire context. Academic responsibilities also come, may not be way up on the top, but it is also important to further the cause of research, have a separate team for that, and work towards helping out in the field of clinical medicine. This is one example where we had conducted a webinar to bust some myths about vaccine and COVID-19 and to emphasize the realities associated with it. with an international panel. Some of the challenges, this is just a revision. It tells you, you will have challenges related to manpower, whether it's doctors, nurses, technical staff, logistics in terms of arranging things for the hospital and ensuring processes are smooth. Infrastructural challenges would be there. There could be equipment shortages like ventilators, blood gas machines, and many other things in this context. So we need to be ahead of the game and ready with that. There will be external challenges as well, like you've seen recently with the oxygen supply or remdesivir, etc. Security issues in the hospital because tempers are running high between the relatives when they are worried about their near and dear ones. And of course, you have to deal with a whole lot of politicians as well. So it's important, therefore, to respect the law as well as the lawmaker. In this context, we also had a vaccination drive, which is ongoing and very successful. We had a huge response in that context, so one needs to organize that as well. And of course, it was great to see our Honorable Chancellor lead the charge in terms of vaccination when, along with Madam, they got vaccinated a while ago. So this is, I think, the last slide possibly. We have to also look futuristically when you're in a leadership position. You have to think of what the future holds when things change. So this is just a quick list of all the kind of various modalities one needs to invest in or think about to take the entire healthcare process forward. You heard from many speakers individually on each of these points, so I'm not going to go into any details there. This is just to end on a positive note. This is just one of our success stories early on. That lady that you see in the purple and white sari in the foreground spent a good 2 weeks on the ventilator and was one of our first patients to be discharged who went through the ICU ventilator, was extremely sick and went home quite happy, as you can see. And some other milestones that we achieved. This was a 95-year-old lady, the oldest that we've had so far, who spent 14 days with us and went home fine. And this, at the other end of the spectrum, this little baby of 6 months, amongst many other little children we had with us as well, sailed through, fortunately. So we look up and look forward, like this kid, to a bright future. And we are hopeful that we'll be able to tackle this COVID-19 epidemic as best as we can. Thank you very much for your attention.
Thank you, sir. There are 3 essentials to leadership: humility, clarity, and courage. Thank you for reiterating the ground realities of this COVID situation and also sharing your experience with us.